is relates to the analysis of enormous volumes of data. And it's not just enormous volumes of data. Data is changing because of the volume, the rate at which it arrives, and the dimensionality, which Lee talked about. This is a revolution, and you're really seeing order of magnitude increases in those dimensions every couple of years. Right? So what we see across the University of Washington is workflows that used to involve, say, a half a person day per week of manual intervention, and now it takes a full FTE. In another 2 years, it will take 10 FTE. And these folks need tools to do the discovery. So 21st century discovery in all fields is about moving from data to knowledge to action. And what Lee is talking about is a key example of that, but it's going to have pervasive impact across all fields. It's going to affect healthcare, it's going to affect the new biology, it's going to affect transportation, it's going to affect energy, you name it. Certainly national security and marketing. So when I then think about the impacts of information, let me say one more thing actually, and that is that the OVP portfolio seems extremely well positioned in this regard. We were talking this morning, there are of course three, in some sense, clusters. There's an IT cluster, there's an energy cluster, there's a health cluster, but they're all rooted in information technology, and a large number of the portfolio companies are rooted in this task of extracting information from large amounts of data. So there's clearly a lot of synergy across the portfolio. So here are a set of areas in health where I think sort of computer science can contribute. One is the whole question of personalized health monitoring, right? And it bothers me a lot that my car, actually not my car, when I drive a car, I bicycle today, I drive a 17-year-old minivan, but my wife's car at least is much better instrumented than I am, right? You go to the mechanic and they plug in a computer and they get a diagnostic readout of everything that's been going on for the last 6 months. And on those rare occasions when I manage to drag myself in to visit a doctor, it starts with sort of, where does it hurt? And so the question is, how is this going to change? And it's going to change very rapidly over the next couple of years. We really have the technology to do this in less sophisticated ways now and in far more sophisticated ways over the not so distant future. And I think, for example, it's going to penetrate through the fitness market, right? There are all kinds of well-instrumented cyclists out there who would like to know when they're going to boink, right? And you have to believe that we could predict when this is going to happen. We're just not doing it yet. And runners and on and on and on, right? So, there's going to be a driver for this, and it's going to change things totally. These days, someone has an unexplained cardiac event, and so they then spend 3 days hauling around 10 pounds of stuff around their waist that instruments them, and then they bring the disk drive into the doctor and it gets analyzed, and this is absolutely crazy, right? So this is an area where things are going to change totally, and it involves technology, but it also involves the analysis of data, right? It is, again, extracting patterns, interesting, anomalous occurrences from that data. A second is the whole area of evidence-based medicine, and we could go on forever about that, but it's machine learning for clinical care, what works and what doesn't work. It's machine learning and data mining for comparing healthcare providers, whether those are individual physicians or hospitals or hospital systems or areas of the country. And we were talking about this morning how to calibrate that for the different customer patient population that different providers may be seeing. It's predictive models, what's going to happen. It's cognitive assistance for physicians. We've made surprisingly little progress since some false starts in the 1980s in helping physicians figure out what they should do in particular situations. So a huge amount of work to be done there. A third one is an area that a faculty member of ours, Yoki Matsuoka, calls neurobotics. This is ever-improving prostheses that are improved in their realism, but that also couple directly to the nervous system, right, in a way that deals with things like spinal cord impairments. So I think there's enormous progress to be made in that area and enormous pressure for it. And the fourth is the P4 medicine that we talked about, right, where, again, I view that as a big data problem. And again, viewing this from a computer science point of view, something I commented on yesterday is exponentials are us, right? And that's the power of the past 40 years, 50 years in the information technology field, and other fields that benefit from that exponential, such as genomics, I think honestly do it in large measure because of the tools we provide, the sensors, which are driving this data explosion, the processing capability that allows the analysis of that data. So I think the partnership is really going to be essential in the next few years.
Larry?